much, Mr. Carney. The next legislation is H.R. 5729, the Spina Bifida Healthcare Program Expansion Act, presented by Mr. Ellsworth.
Thank you, Chairman Mashu, Ranking Member Miller, and members of the subcommittee. I'd like to thank you all for inviting me to testify in support of my bill, H.R. 5729, the Spina Bifida Healthcare Program Expansion Act. Last year, I testified in front of the Veterans Affairs Subcommittee on Disability Assistance and Memorial Affairs on behalf of my constituents, Honey Sue Newby and the Nesler family of New Harmony, Indiana. I shared the heart-wrenching story of Honey Sue. This is a woman who lives with a complicated neurological disorder rooted in spina bifida, and her parents, Susan and Ron Nesler. They provide around-the-clock 24-hour attendance and care. Honey Sue's biological father served 8 years in the Marine Corps and completed 3 combat tours in Vietnam. The VA concedes and testifies that Honey Sue's condition is the direct result of her biological father's exposure to Agent Orange, a defoliant and herbicide used to protect our armed forces in Vietnam. I hope that H.R. 5729 will provide people facing the same challenges as Suzanne and Ron immediate relief from the paperwork and give them the peace of mind that their children will have unconditional access to attendant care when they're no longer capable of providing it themselves. With the passage of this bill, Honey Sue and the estimated 1,200 children, I'd like to emphasize this is only 1,200 children with levels 1, 2, and 3 spina bifida, as caused by parents' exposure to Agent Orange that we dropped on that country and dropped on our veterans. They will receive the same full health care coverage as the 100% service-connected military veterans. I introduced H.R. 5729 in an attempt to clear the seemingly insurmountable bureaucratic hurdles that continue to frustrate the Neslers. Each time the Neslers seek medical care for Honey Sue, they must provide a letter from a doctor from the VA stating that her condition is directly related to spina bifida. That's a given, it's been testified to, and it's proven. The Neslers must repeat this routine despite the fact that Honey Sue is recognized as a Level 3 child. And as you know, Level 3 children are eligible for the same full health care coverage as a military veteran with a 100% service-connected disability. I look forward to working closely with Dr. Gerald Cross, the VHA, and House VA Committee to ensure this legislation provides the Neslers and other families caring for children suffering from spina bifida with the much-needed and long-overdue relief from the tremendous bureaucratic hurdles that they currently face. I'd also like to take just a moment to thank Kathy Wimblemoe and Mark Heyman with the subcommittee staff for being so helpful in this process. I look forward to hearing the expert testimony from the witnesses on Panel 2 and from Dr. Gerald Cross on Panel 3. Thank you, and I yield back.
Thank you very much, Mr. Ellsworth.